Welcome to Michigan Medicine. We are glad you have chosen us for your care. The purpose of this video is to provide education and resources to patients who are considering having a tracheostomy procedure. In a moment, we will discuss what to expect and how to prepare for this procedure. We will review this information with you and your family members in detail before you are discharged. This video is divided into 6 modules. Each includes topics you will need to demonstrate prior to leaving the hospital. These modules will cover your hospital stay, what to expect following your discharge from the hospital, tracheostomy suctioning, care and cleaning, tube feeding, tube medication, and finally, we will provide you with some additional tools and resources. Being prepared ahead of time will help your discharge go smoothly and make your recovery at home much more comfortable. Module 1. Your hospital stay. During the first few days in the hospital, you will find yourself more comfortable in the hospital gowns that we provide. Our gowns simply make it much easier to deal with your IVs and cardiac leads. As you begin to feel better, you may want your own slippers and a bathrobe, and other personal hygiene items such as chapstick, because the climate in the hospital tends to be quite dry. Immediately after your surgery, you will move to your room on the inpatient floor. You may still feel very sleepy, but the nurses will monitor you very closely.
Okay, and if you need anything, just make sure to hit your button. Don't try to get out of bed without me, so just, if you want to get up, go ahead and hit your call light, okay?
Mr. Underwood.
Your healthcare team will discuss all plans with you and your family daily.
Thank you so much.
You're welcome.
Hello.
Hi, Mr. Smith. Kristen, your nurse. I'm back.
Your nurse may also administer some new medications that will improve your recovery, in addition to any regularly scheduled medicine that you take on a regular basis. One of these will probably include a blood thinner shot twice a day. This will help prevent blood clots. If you have any questions about your meds, dosage, or delivery schedule, please feel free to ask your nurse. The physical therapy team will work with you if needed. Their job is to help you get stronger while keeping you safe on your feet. Mobility is one of the main keys to a successful recovery. There are several things you will want to prepare at your home prior to leaving for the hospital. Choose a clean area in your home to store the medical supplies you will need during your recovery. Prepare some hand sanitizer and have soap and water readily available. Contact your local emergency services to let them know about your situation.
Hi, is this a non-emergency line?
Tell them that if you call 911, they should send a response unit team right away, because you may not be able to talk to them.
Thank you very much.
Check your smoke detectors, because your sense of smell may not be as sensitive as before surgery. Plan for a family member and a friend to serve as your primary caregiver, who will stay with you as much as possible during the first few days that you are home. You may also need to enlist additional caregivers to be present when the primary caregiver is not available. The primary caregiver will help you learn how to care for yourself after you get home.
So I won't be able to talk after surgery. How am I going to communicate with you guys?
Yep, that is true. You won't be able to talk after the surgery, but we can facilitate communication through other ways.
Okay.
Making your needs known after surgery may be difficult and frustrating, so you should prepare dry erase boards, notebooks, pens and pencils, and word boards like these to help you communicate. If you use alcohol regularly or suffer from depression, talk to your doctor before surgery. Alcohol use and depression may affect your recovery.